Small boobs don't have enough milk.
I used to.
Breast milk should never drop in the baby's joints. The joints. And I'm thinking, when?
We even shower. What are the risk factors that someone should look out for when they're breastfeeding while pregnant?
Nothing. Have your breasts checked. I'm sorry, these extensions are not good.
No,
but have your breasts checked.
Yeah.
Because that's in the antenatal period.
Yeah.
That's when we'll be able to tell that your nipples are flat, inverted. You have accessory breast tissue under your arm, which can get you.
Hey guys, welcome back to the channel. Today we are doing a video that has been requested for a lot, and it's one on breastfeeding. We're going to be answering all your breastfeeding questions, all the myths that you've had. We're going to ask the expert, are they really true? And we're also going to be touching on tandem feeding. What is tandem feeding? Let's get into it. So with me on set today is a lactation specialist, Dr. Doreen. Welcome to the channel.
Thank you.
Would you want to introduce yourself to my audience?
Yes. Thank you so much for hosting me. My name is Dr. Doreen Mazakwe Semuju. I am a mother of 3 wonderful children, breastfed for a total of over 6 years. I am a nutritionist, a medical doctor, and certified breastfeeding specialist. I've been in practice for over 9 years.
Wow.
Yes.
Wow. That's amazing. What made you get into this field? Because I've not heard of many medical doctors that are lactation specialists.
Well, it was my own troublesome start. As a doctor, I thought I needed to have known everything concerning human life and human care, and this time baby care. But once I got pregnant and I had my first child, it was challenge after challenge after challenge for the first 2 months. And yet I was in the midst of health professionals. I gave birth in a hospital. So there were midwives, there were
a proper hospital.
Yes, a hospital, a private hospital. So we expected that, all the services you ever need or will ever need were available. But even being in the midst of so many professionals, I still had breastfeeding challenges. And I met each of those people at least twice in the first 2 months.
Wow.
But I still had all sorts of problems. I was like a
help.
textbook. And I felt that I didn't get the support I needed from those professionals.
Yeah. But thank God now we have you.
Oh, yeah.
So what was one of those challenges that you faced? Like the major one that said, you know what?
The one that really got into my hair was nipple sores. Those things are painful.
They are painful. I was telling her that's premium pain because I got them with my first. I had no idea how to do anything. And then my nipple said, "Hattie." My mom said, no, it happens. The boobs are going to get used.
Guma.
So I just use nipple cream and kugumad. How do we navigate nipple sores? Does it have to happen?
No. Well, so I had nipple sores on and off, nipple pain for about 2 months. And I think I just kugumad through them and they just went away. But over the years, I've come to learn that you don't have to have nipple pain. You don't have to have nipple sores. You can breastfeed without any of those 2 nasty things.
Yeah.
Once you have the right support with latching, positioning, and maintaining a good latch throughout the feed, good nipple care and breast care, you will not have nipple sores.
Now you've touched on latching. What is latching? How do you get latching right?
Okay. So over the years, I have learned that not one technique works for every mother because mothers have different bodies, have different babies, have different breasts, different nipples.
Yeah.
Believe you me, there are different things under the
Down
bra.
there.
But generally speaking, the baby is competent. They usually know what to do. Once they are healthy and born without any complications, they know what to do. They have reflexes, what we call reflexes, which signal to them that now it's time to eat. Now it's time to open your mouth. Yes, and this is how you open your mouth. You open this wide, you know, and not that wide, that narrow. This is how you know you have to face the breast. They know all those things. Now then there's also the mother, who for most first-time mothers and those who are and those who have never had any support or anyone showing them how they should position the baby and all those things. So there's the mother who needs that education. So when you put those two together, those two things must be working. It's like
hand in hand.
Dance, it's like a ballroom dance where, you know, once that signal comes, the mother knows what to do. And So now when it comes to basics of latching, first of all, it starts with the position.
How you hold the baby.
How you hold the baby. Should you hold that baby in a way that does not allow them to use those reflexes and to come close to the breast, you'll already be straining. So most mothers are bending. So if they're seated in a chair, they are bending.
They bring the boob close to the baby.
They really try to be nice to the baby.
Should we get a prop?
Yes, please get a prop.
How do we hold the baby?
So, this is your baby. Let's say they've woken up. First of all, they are what we call feeding cues, like signs that they want to feed. If I asked about 5 people, what is the sign that shows that your baby is ready to feed? I'm almost 100% sure they would say crying.
Yeah, there's that cat crying. Nah.
Not that one. The scream. That's the one. That's the one most people
recognizes.
And unfortunately, even some health professionals say so. But the first sign, for example, is rapid eye movement before they wake up, and that's the best time for you to do the positioning
before they are
frustrated. Before they start screaming. Because once they start screaming, the tongue goes up. They don't latch properly, and that's a problem. So anyway, if this is your baby, there are a number of positions you can use. So there is the good old cradle hold. So with cradle hold, can you imagine if you're an adult and you're seated like this, and they tell you to feed from this side? So they tell you feed like this.
You're seated like this?
Yeah, but they tell you feed like this. That's what most mothers are doing with babies. So they are holding them like this.
And that's what I did with my first.
Oh yeah.
I remember.
So it usually starts with position. So they hold them like this.
And
put
then
them
they turn the baby's head.
Yeah, and then they turn the baby's head. Meanwhile, the breast is here, but your baby is here. So that's the issue again I have sometimes with nursing pillows. They are so low, and for some moms they just won't work because the boobs are high.
Boobs are up here.
So whichever size of boobs you have, just make sure your baby is at the same level as your breasts if you're using the cradle hold. So your baby's bum needs to be in your palm. Like that.
To palm.
Bum to palm. Then your arm supports their spine and their head. So their head should be facing your breast directly.
Not their head here, the elbow.
It can be here, it's okay. But because some moms have shorter arms. So your baby will face you. Now, once your baby faces you and your breast touches their face, they'll already start using those reflexes to look for where the breast is. There's a rooting reflex, and then there's the opening the mouth. So that these babies have those reflexes around the mouth. So once your breast touches the chin of the baby, the nipple will automatically go up.
So say this is the nipple, and then this is the breast. This lower part, this one, is the one that should touch the chin.
Exactly. The areola should touch the chin. That's where the reflexes are. And once you do that, your baby will start opening the mouth wide. And they'll open it really wide, like they want to yawn.
And when they open it really wide, that's when
you literally slide the breast in. So you'd do this. Contrary to how people do bottles. With bottles, people usually just poke the boob in. Although there's also what's called paste bottle feeding. But, you know, you slide it in as they open their mouth. And the correct hold the breast is with your forefingers under what they call the C hold.
The thicker.
So the forefingers under the breast, away
Like
from the
this.
areola, and the thumb up.
You hold down and hold it
Yes,
upwards.
exactly. And then you do that because you want to stabilize the breast, so that it doesn't slide out of the baby's mouth.
Yeah.
Also, so that it's not too heavy, so that the baby doesn't struggle trying to hold on to it. So that's the cradle hold. And then there is cross cradle. Cross cradle means you cross your arms. So the arm that has been holding the baby now holds the breast, and the other arm which was holding the breast holds the baby.
Okay.
So the touch points now are no longer palm to palm. Now it is this web between your thumb and index finger goes just at the nape of the neck, not the back of the head. They push their head backwards if you try to
hold the back. Yeah.
So this is just to stabilize them more around the shoulder blades and at the nape of the neck. Then you hold your breast
with this other hand.
Yes. And then you move the baby to the breast. And the baby's tummy to your tummy. So tummy to tummy, palm to palm. Yeah.
So you move the baby to your... I remember with my first, as soon as I would see him open, I would move myself to his mouth.
Well, that will already cause back pain for you and cause tension in your shoulders, and your baby won't latch properly. Not because they can't latch properly, but because the position is faulty. So you do that. So that is the cross cradle hold. This one is very good for mothers who have had C-sections because it spares the wound, but also very small babies like preemies and small for gestation age babies. But also first-time moms, I usually recommend this because it's easier for them to control the movement of the baby. Then once you're comfortable with this, then you can switch back your arms and
to this.
There is the scissor hold, which I would only recommend if the flow is too fast. So if your baby is choking, you can try the scissor hold.
So the scissor flow helps to reduce the flow of the milk.
Yes, because it cuts off the ducts. But the disadvantage with that is you can cause milk to back up if you do it too aggressively. Then the other is called underarm or football.
Let's say.
So this one, you use the same techniques you use here, but on this boob now. I like to use this position for mothers who have flat nipples. It really helps them to shape the breast, but also to just see what's happening.
I'd also think it's good for C-section moms.
Yes, too, because it also spares that place. You definitely need support under your arms here.
So a pillow.
A pillow under here is good enough. Then there is side lying. I don't know how I can show you side lying.
When you're lying down on the bed.
When you're lying on the side.
And then you give the boob that is down, right?
Yes, just like how you do in cradle. And then there is laid back. Laid back means you slant backwards and the baby comes from up like this.
At what age can you do that one?
From birth.
Really?
Yeah.
Wow.
So if you've had a C-section, while you're on the table, they can put the baby on you like this.
And you...
Yes, they just need to remove these theater clothes. And leave your hands free, and then put the baby across like this because they are working down here and this place is covered. So this is a position you can use. But now you just imagine I'm lying totally flat. You can use this position. The baby doesn't suffocate, and in fact this is the best position because it's the most natural position for them. So there are about 5 positions you can use to get the baby on. But the latch is pretty much similar.
So to get a good latch, you get the areola to touch the baby's chin, and then you wait for your baby to open their mouth like they're yawning, and then you slip the nipple in. You don't bend.
You don't go to the baby. You bring the baby to the breast.
Okay.
You don't take the baby. You don't take the breast to the baby. If you're to adjust anything, you should adjust the baby and not yourself. So you find a comfortable position. People don't really mind about the mother's comfort, but that's very important.
It's very key.
Because
you're going to be breastfeeding for at least 6 months.
Yes.
At least 6 months if you're able to.
And several times a day.
Yeah, it's a long time for you to be bending. Then if you've had a C-section, that's even
longer and worse. But also pain and discomfort really inhibit the flow of the hormone called oxytocin, which is what makes your breast milk flow. Yeah, so you need to find a comfortable position. If you're in pain from stitches or from a C-section, you need to first find a comfortable position where you're not in pain. Then you can get
One
the
thing
baby
that
to
I have learned
attach.
also that I feel like every new mom needs to know is that breastfeeding doesn't have to be painful.
No.
It should be comfortable. Once there is pain, something is not right.
Exactly.
Yeah.
Exactly.
So
Once
if
there is pain, there is something wrong. No matter what the latch looks like outside, there's a
inside
problem.
there.
Yeah, there's a
So you
problem.
to remove the baby from the boob, I learned that you slip the finger.
Yeah, in the
That's
corner
okay?
of the mouth.
Yeah, and then
And you turn it outward. You pull it outwards. It
so
will
that
break
the
the
baby
seal.
can get off properly, and then you
Yes.
try again.
Again, exactly.
Yeah.
Which is why you should try to breastfeed the baby before they start crying. Because if you do that and then you have to reorganize the latch, you're frustrating them even more.
And you're also getting
And
frustrated.
you're also getting frustrated.
Yeah, I want us to also bust some myths because there are so many myths around breastfeeding that we have believed that our mothers also know and have carried on to us and are just making this whole process harder.
Yes. So there are so many myths. I don't know if we can bust all of them, but let's
Give
try
us
to
like the
bust
top.
some. So one is that to have a good supply of breast milk, you have to eat for 2 and more.
That starts from pregnancy.
You have to eat for 2 and more. It is not true. What we have just described about how you latch the baby well is the primary way your body will make milk. Because if you latch well, then your body is able to release milk well, and the baby is also able to get as much milk as you're making.
Yeah.
And then the mechanism is for the body to replace what you took out.
Yeah, and breastfeeding is demand and supply.
Yes.
So the more demand,
And the demand is read by how much
the
milk
baby
is
taking
removed.
out.
Yeah.
Yeah.
So this is why we also do reviews on mothers when they've just given birth, because we want to see whether this baby has any issues in the mouth that might make it difficult for him to latch
What are those
or
issues?
extract. So there's an oral exam that we do on the baby, because the baby's going to use the
mouth.
lips. So we want to see what's the tone of the lips, what's the tone of the cheeks. If they are preemies, they have very little fat, so it's difficult to stabilize the breast, but it's also difficult to sustain a long feed.
They get tired.
They get tired. So if the baby has no fat pads, they call them cheek pads, it will be difficult for them to breastfeed sufficiently. We want to know, is this baby a preemie or a full term? How soon were they born, even if they are full term? If they are beyond 37 weeks, was it 37, 38? Those things tell us how ready this child is able to breastfeed. We also want to look at the tongue. So the tongue is the most important in the mouth, because they
the
suck
one
with
they
the
use
tongue.
to-
Yes. It's the one they use to hold the breast, lift the breast,
And
hold the breast and
suction.
suck. Yeah. And seal the breast to make a negative pressure in the mouth. So if all those things are being affected either by poor muscle tone of the whole baby, such as babies with Down syndrome, or if the baby has a tongue tie, or if the baby has tight jaws, like when you try to open their mouth, it's so tight, especially for babies where the mother tells you, I feel the grip is so strong. That might sometimes go back to how they were born. They could have issues with their jaws, their muscles. If they were born under difficult circumstances, if there was a vacuum
Birth
extraction, any kind of birth trauma and injury can cause problems with latching. So that's the baby. This is why I also say that even if you're an experienced mom, it doesn't matter, because you are the same mom, but the baby is different.
yeah.
The baby
And
is
also
different.
you could have it easy with your first and then the second.
Yeah, because the babies are different.
Yeah.
You can't assume that it all
will be
works
the
together.
same,
So your experience is valid and very important.
Yeah.
But when it comes to that new baby, it's a whole new experience.
Yeah.
So we want to see what's happening there. We also want to check on the palate. Sometimes
The palate is the
roof of the mouth and the flow of the nose. So we want to know, is the palate flat? Is it curved a bit? Is it high? All those things can cause, for example, nipple pain. It's almost like the palm of your hand. If you turn it like this,
down.
yes,
Okay.
it's gently curved.
Yeah.
If you put in your finger, it would sit nicely on just on this tip. But then there are those where you feel like there's a hole, not a hole like with an outlet, but you feel like your finger is going further inside, those arched palates. It means once the mother is latching the baby, the nipple gets trapped up there. So we want to support the mother with different techniques to help her with
breastfeeding.
Yeah. Then we have to look at the jaw. Some jaws are recessed, so you find that the normal jaw looks like that, but you might find some babies have it's smaller. Yeah, it goes straighter. It doesn't have this prominent chin, or what we call the mentum. So we want to see that whether that baby has that. It poses difficulties also with latching. We want to see if there is symmetry of the face. So is one side of the face, more inclined downwards? Those happen with birth injuries. So even the way the baby is born is important. It has an effect on all those things. Epidural is the it's the new thing.
I was supposed to get an epidural.
Epidural analgesia is pain medication when a mother is giving birth. For about 10 mothers, I would say I've seen difficulties feeding and latching in maybe about 5 of those babies.
Okay.
So 5 of them could come out and everything is okay, but the medication the mother got for the epidural sometimes goes to the baby. And the babies, all their reflexes are suppressed. So they don't root, they don't suck. You would have the breast in the mouth, but they are just not sucking. And that wears off in about 24 hours, 18 to 24 hours. So those are some of the things we look for in the mouth. Sometimes a lip tie, but I don't usually do so much about lip ties unless it's obvious that they can't form a seal. With tongue ties, they're surgically cut. And there are different grades of tongue ties. And there are babies who have classic tongue ties but with normal tongue function. And then there are those who have classic tongue ties with bad function of the tongue. So with tongue ties, it's not just about how it looks, it's also about how it works. So there are different things we do to check that the tongue is working. So we do that in an assessment for the baby, an oral assessment.
So it's important for when a mom gives birth to see a lactation specialist, because you find that many of our gynes, the gynes are concentrating on you. The ped who comes to see you, because Nakasero has peds, checking on the baby. But who is checking on these other things? Like when they want to see that the baby is okay, no
everything
temperature,
is okay.
They are gone. But now the breastfeeding.
Yes, and it happens between 2 people, not just one person. So then there's the general health of the baby. If they have cardiac issues, it means they'll get tired because they are using a lot of energy. If they have respiratory issues, they can't latch because they prefer to breathe. If they are throwing up, then they can't keep food down. So no use trying to pump them with food. So just the general health of the baby needs to be, checked and making sure the baby is healthy. They don't have certain conditions. I mentioned Down syndrome. Down syndrome babies have very low muscle tone, so they can't breastfeed, to sustain a feed. So a ped would usually have assessed and told you, this baby has Down syndrome. Or you would see, because we are doctors. So that's important. So you look at this baby in that whole context of how they were born, their first hour or 2, and how they've generally been behaving. Then you go to the mother. So with the mother, you're mainly looking at, structurally, let's talk about the breasts. So if your mom, some other simple things, if the mom has a cannula on her arm, it means you're going to have to choose another breastfeeding position other than these. As a matter of fact, I actually found one on Thursday. She had a cannula on this arm.
And the baby was...
So trying to put the baby on the breast was difficult because she was in pain. And then using this other side was difficult because this arm was painful. So she couldn't do that. So we had to use sideline. So those things are best recommended for people who have seen different situations, and you can, off the top of your head, recommend something suitable. But the issues with the breasts are the size of the breast. Size.
Too big, too small.
I wanted too big, I wanted too small because, those are variations. We can't say this is the best breast. Everyone has their breast.
There's nothing like best.
There's nothing we are going to do with that breast. It has to do the work it has to do. So if it's large, there's a challenge there with managing the breast. If it's very small, there's also a challenge because you have to bring the baby right up. If it's very large, you could afford to do that. If the nipples are facing outwards, underarm would be nice. If the nipples are small, that doesn't matter. If the nipples are very large and long, that's a problem for the baby, because the baby might feel like the nipple itself is feeding the mouth.
The whole boob.
So now we can't latch properly.
And
So
then I've heard of flat nipples.
The inverted ones. So they are inverted nipples and they are flat nipples. So those ones, the nipples are going inside instead of coming out. Like instead of
And
being
then the flat
inverted,
ones.
the flat ones are just at the level of the areola. So
It's neither inside nor outside.
Neither inside nor outside, it's just there.
Wow.
Now those ones pose difficulties with latching because babies have a strong need to suck. So when something rigid touches their nipple, they begin sucking. So when that is not there, they just slide off. So you just find them sliding off, and the mother is really having difficulties. Yeah, the best with that is to shape the breast.
With your hand.
Yes, you shape the breast to form something where the baby can attach. So something like this, as opposed to
just putting the baby.
So you'd have to compress and do that. Along with what the other things we mentioned before. Sometimes, of course, we have to personally look at this breast and look at the mother, look at the baby, and see what works best for this particular baby mother couple.
Another myth?
Now, other myths are small boobs don't have enough milk.
I used to believe that because I've always had small boobs, I think, from my mom. They're not small. I thought this was small anyway. So I always thought that because my boobs are small compared to my peers, I didn't think I would be able to breastfeed my babies. And then last year we are 3 babies in.
Well, there are certain breasts which didn't develop very well. We'll not talk about those today. But that's just a myth. The size of the breast has nothing to do with the capacity of the breast to make milk. It's about storage. It's really storage. Breasts which are small have less fat, so they have more storage capacity. Breasts which are large have more fat, so less storage capacity, meaning they have to be emptied more frequently than So you make more milk probably within a certain amount of time and store more milk compared to the one. But the capacity to make breast milk is not about the size. It's about what is in the breast.
How much is being taken out?
Yeah, how much is being taken out, but also what's in the breast.
Yeah.
Because there is machinery in the breast to make milk. That's why your breasts increase in size when you're pregnant.
And breastfeeding.
Yes. Now, the other myth with breastfeeding is breast milk can never drop on your baby's body. It can never drop that.
Wait.
I don't know. I found one time a grandfather telling his daughter that breast milk should never drop in the baby's joints. The joints. And I'm thinking, when
we even shower breast milk?
And I'm thinking, when would breast milk drop in your baby's joints? There's a mother who refused to, who was afraid of doing skin to skin because she felt breast milk will drop in the baby's ears. And the baby will get pus in the ears. But pus in the ears is an infection. It's not an issue of breast milk entering. The other myth is, you can never be able to breastfeed exclusively. That you can't. Like, how can a baby live on breast milk only?
For 6 months.
For 6 months.
Some people keep saying, give the baby some water.
Give the baby some water. But if you look at breast milk, it has a huge percentage of it is water, liquid. And it has everything in the right composition, right temperature, right, especially for the baby's changing needs. Which is different from other types of breast milk substitutes, which are the same from 0 day to 6 months. It's the same composition. With breast milk, it's different composition based on the baby's needs.
So, first demystify this. Does a baby below 6 months need water? Do they?
No. If they're breastfed, they don't need water. Well, they need water. And it's in the breast milk. It's in the breast milk.
What would you tell a mom who is formula feeding? Should she also give water?
Yes, she should give some warm water.
Okay.
Some warm water, maybe a teaspoon or two.
But if the baby is exclusively breastfed, no
need for water.
Okay.
So the formula feeding baby is already receiving that water in the formula. So they have to reconstitute it, which is okay. But also the protein contents in formula are different from those in breast milk. So they need more digestion. But the instructions are on the tin based on what the manufacturer made.
Okay, another myth.
Now, another myth, interesting myth is breastfeeding mothers. Breastfeeding mothers never get any sleep.
It's little. I will
It's
not
on the
deny
low
that.
side.
It's
It's
little.
on the low side. Well, the research shows that mothers who breastfeed get better quality sleep, not quantity. Better quality sleep. Even
Not
the formula,
quantity,
even the
like
ones who
quality.
even the one to formula feed also still complain of sleep deprivation.
Yeah.
And largely, this sleep deprivation is because your sleep patterns have been totally disrupted
Distorted.
and distorted. You're now awake at night, yet you used to sleep. So that way your body takes it, and as your body is trying to adjust to it, it's very difficult. We are not downplaying sleep deprivation. It's real.
Yeah.
It's so bad.
And yet they tell you need enough sleep to breastfeed properly.
Well,
Yeah.
and interestingly, during the day, you're not interested in sleeping because that is not.
It's during the day.
It's during the day. You should be awake.
Yeah.
But well, at night, when you're able to breastfeed your child, you're comfortable and your child feeds well, your child will sleep well. And once they sleep well, you will also try to get some of that 2 hours sleep. So sleep comes in 2 hours, or even less for some mothers who are having challenges. But as a breastfeeding mother, you can't sleep. It might not be what you want, but you can have some sleep. So please don't give up breastfeeding because you need to sleep. But of course, that is dependent on each mother. Things are not the same for every mother. What I can handle, another mother might not be able to. If you really feel you're at the end of your rope with sleeping, please approach a professional or a peer counselor to support you with how to make those sleeping arrangements and not affect the baby's
breastfeeding.
Yes.
I also wanted, I don't know if it's a myth or what, but I feel like while breastfeeding, the sensitivity of nipples reduces
Or increases.
Reduces. Changes completely.
It does.
Or for some, even non-existent.
It does. That is true. I won't even talk about myself. But
please talk about yourself.
But it's true that the sensitivity reduces because of the constant. Remember, especially if you were a first-time mom, you have not breastfed a baby
before.
So if you a newborn baby,
not an adult.
So you haven't breastfed a baby before, and this baby is going to constantly be feeding.
At least every 2 hours.
Every 2 hours, or even multiple times in those 2 hours. So definitely that sensitivity is going to reduce because, and also the way you perceive that sensitivity is going to reduce. I think though also that so many things happen in your mind as well.
You stop to perceive it sexually.
Yes. You stop perceiving it sexually. Now that's why breastfeeding in public, people need to understand.
All shame goes out.
All shame goes away, and now it's about feeding the baby. And remember, breastfeeding is associated with letdown of breast milk, which is mediated by oxytocin, same hormone that mediates orgasm. So there is a mini feeling of that nature, but it's not going in that direction. So you're not going to associate the letdown with orgasm. You're going to probably associate, although I know there are people who have such experiences. But that's the same hormone. So the sensations might be similar in the breast, in your uterus. All those sensations are going to happen. So the sensitivity of the nipple is going to change, but also your perception it's going to change because now you're feeding a baby. You're not thinking about sex. You're thinking about feeding
the baby.
So unless it is, time of intimacy with you and your husband, then now you might have to switch from, it's the baby.
But that switch is hard.
I know that switch is hard, but you get there. You get there over
gradually.
time. Again, you reorient yourself.
Your mind.
Please talk about it with your spouse as well. Yes.
Babe, we're going to talk about that. Another thing I want us to talk about that I discovered this third time was the witching hour. Is that stage when the baby is a newborn and they cry between, I've forgotten the hours, between a
Yeah, in the
certain hour. So
evening.
many moms worry that maybe they don't have enough breast milk. So tell us about that.
Well,
one.
that witching hour is the time when babies, usually it's in the evenings. So maybe around 5, 6, 7, sometimes earlier. It's also the time when they are doing cluster feeding.
So they're always
So
on
they
the
are always on the breasts. They are there for maybe 20 minutes and you really see that they are feeding. They're swallowing. Everything is going well. Then they get off the breast. Then they look like they
They are hungry. They
are
have never
so
fed.
hungry. They've never fed. You didn't do anything. They come back. You get them on. And they do the same thing. Then they take another 10 minutes. Then they come back. They do that for several hours in the evening. They are very fussy. They cry for no reason. They are clean. They are dry. They are fed. So usually mothers feel like
Maybe it's my milk.
my milk is not
Many
enough.
times, that's when people introduce
Introduce
formula.
them. Yes. And also sometimes those things coincide with the first growth spurt, which is between 10, 14 days. It's the worst, it's the first one. And baby's not sleeping. You wore a lasso in the morning, your husband comes back from work and you're in the lasso. And you're like, what has happened today? The first time it happened, I was like, what is happening?
What's wrong with me?
And that's the same day when someone decided to dismantle some metallic things in the compound. It was
And make
not
noise.
cool, yeah. But it went on for, like
days.
3, 4, 5 days. But most mothers will tell you when they stick with exclusively breastfeeding, they'll tell you that at the end of it, they had too much milk and the baby was sleeping. So they're like, there's so much milk in the breast and the baby's sick. That's after the growth spurt has passed. With the cluster feeding, they usually feed, so many times in the evening, and then they sleep for a longer time in the evening before they wake up again to do the normal feeding.
Yeah.
But that witching hour is usually around that time. Now, tips for witching hour.
Yes, please.
Do all the soothing techniques. So one, I recommend skin to skin. Very important because it will help your oxytocin increase and help the milk flow. But also babies love skin to skin. It really calms them down. Yes, they feel close to you. It calms them down. It gives them a good rhythm to maintain all their vitals. So heart rate, blood sugar, blood pressure. Skin to skin regulates all those. 2, a warm bath goes a long way. A warm bath, and every mother should learn infant massage. Infant massage. I can't demonstrate any massage.
YouTube University.
Yes. So infant massage is very, very good because it releases all those feel-good hormones for babies.
They're able to relax.
Yes, and the mother also feels like she's trying to do something to help her baby. There's what they call the colic hold. Colic hold means you turn your baby to face away from you, and then you slip your hands in between their legs, and then you gently let them lie on your forearm with the head. Yeah. So they say this dangling limbs feeling helps them to feel relaxed and releases the tension from their body. But also if they have like any gas issues, this compression on the left side where the stomach is helps them feel better.
So you hold them with
So you hold them like that, yeah. So you can cross, add on
I'd
the
see
other
my
arm.
husband hold Sunshine like that, and now it makes sense.
Yeah. So you hold like this. This is also so much better than shoulder
Here you even
torture.
get tired. It's very tired. For me, this is my go-to.
Shoulder torture.
Yeah.
I don't like shoulder tortures. So I do this, so this would really help. Noise. Some noise for the baby.
White noise.
So-called white noise. I don't know
That's
why.
like
I don't know
a
why
dead
they find
radio.
it
Those
nice.
radios
Yes,
that are.
yeah. But me, I would put music, and the baby would keep quiet or sing. Sometimes also rising from this position also changes the baby's position a bit.
Yeah.
So from as if they are lying down, you stand up. They are still lying down, but you're able to move, and they feel different.
Yeah.
If they have gas, then soothe their tummies, either massage, a tummy massage. There's that called bicycle legs.
Clockwise. I was told
Yes, it's a clockwise movement because that's how the
massaging,
intestines move.
Yes.
So you massage with the pressure, with not so much
Put up here so
pressure.
they can see.
Sorry. So you massage clockwise around the
navel.
the navel. So you massage like that, and then you get those legs, and you do the
bicycle
legs. At the end of it, you can press the knees against the tummy. You hear some gas coming out. If they had issues with pooping, they might be very happy to poop.
Thank you for that one, because that's a very frustrating stage of motherhood.
Very.
The next one I want you to talk about is for especially C-section moms. I've heard that many C-section, you were a C-section mom 3 times. Perfect. So it takes a while for the breast milk to come in?
Not entirely true. So for the C-section moms, having a C-section is one of the reasons mothers will not start breastfeeding early. I actually happened to do a research on that for my master's. And the number of mothers who breastfeed early, which is within the first hour of birth.
The first hour of birth.
Yes, it has to be within the first hour of birth. That's what it defines early initiation of breastfeeding. It has its benefits. You can go to YouTube and learn about them. But among them is just the baby getting that colostrum, which is their first immune boost. But also just being close to their mom. And when they're alert and awake, that's the best time for them to feed, because they're going to fall asleep. So C-section, only 18% of C-section moms in the hospitals where I did my research start early. Meaning the whole 82% of babies are starving, or they are giving them something else. And yet we are saying colostrum should go in fast so that it coats the whole place, and you know. So for C-section moms also, sometimes because of a traumatic labor, breast milk can take a while to come in. But also sometimes the reason why they had the C-section might be the reason. So for example, if they are diabetic and the baby is too big, emergency C-sections, hypertensive mothers, you know, and all that.
What's that called? That risky thing.
Preeclampsia.
Preeclampsia.
So all those stresses can delay milk coming in. However, mothers can be supported to breastfeed right from when they are on the table to the recovery room, to the
given
room.
us a position.
Yes, lie flat. That position, unless it's the health workers who do not know about it. But you know, as one who is listening to this or watching this video, you can advocate for yourself and say, please, can I have my baby on my breast within the first hour? If I am okay, if I'm healthy and baby is healthy.
For us, usually when our last antenatals, we tell our gyne, this is the birth plan, this is what we want. I remember with our first baby, we told him as soon as the baby comes out, put him here, the father will cut the cord. Like we told him skin to skin is important immediately. So discuss the birth plan with your doctor. If you want to breastfeed you, and if you're a C-section mom, tell him, I want to breastfeed, and you explore that.
Yes, explore it together. Sometimes your medical team might not be as informed as you are, or sometimes it might be convenient to just take the baby away
and
dress them up. And once they dress babies up, it's difficult for mothers to
undress
the baby and say, let's do skin to skin. But these things also start in the antenatal period, where you have antenatal sessions, classes, not the visits to the obstetrician, but a class, like a 2-hour session on importance of breastfeeding, all these tips and techniques we are talking about, skin to skin, why those things are important, what they will do for you and your baby. And so it starts from the antenatal period to make those decisions and to come up with that birth plan, which includes breastfeeding.
Okay. So, now, can you give us tips on tandem feeding?
Well, we'll start with breastfeeding when you're pregnant.
1 second. Okay. Breastfeeding.
So when you're pregnant and when you're breastfeeding a baby and you get pregnant and you conceive, no matter how old the baby is, the one who you're holding, it is recommended to continue breastfeeding for as long as both of you can continue breastfeeding, including to the time when the newborn comes. You can continue breastfeeding, and that's what they call tandem feeding. When you're breastfeeding two
two
babies of different ages. There and who are not twins.
Okay.
So
They're called Irish twins.
so they are not, you know, those twins
They
you,
did
you
share
had
the
that.
womb.
Yes. So during pregnancy, the only two things change: the volume of breast milk because of the volumes, rather the hormones
So
in
it
the
becomes
mother.
less?
So it becomes less. It reduces in volume. That's why when mothers have low supply, one of the things we ask them is, "Are you pregnant?" It can cause because now the hormones shift. So now we move from prolactin being the predominant hormone to progesterone and estrogen now rising because of the pregnancy.
Okay.
So the volumes might reduce, but also the taste changes. So there might be more different components of breast milk now at play. It's just saltier. It doesn't taste as sweetish as it used to.
Naturally, breast milk is sweet.
It's not really sweet. It's like ORS.
It's like ORS.
It's like ORS, milky ORS.
Yeah, yeah.
With a tinge of sweet. So now when that changes, the baby might self-win.
Yeah.
They can tell. So they might self-win and decide, no, I don't like that anymore.
This is not what I signed up for.
No, I'm out of here. But but you know that the average baby, I think, will want to continue breastfeeding.
Yeah.
And the average mother will also want to continue breastfeeding.
Yeah, except that I think one challenge that I faced was my nipples were sensitive in the first trimester.
So that's the challenge in the first trimester where the nipples are now, you know, sensitive and they are feeling pain. And if you have a rambunctious baby who pulls on the nipples or
like,
who does what, you're like, no, I'm done with this.
Yeah.
But other than that, most mothers will pull through it because, like you said, they're still in that age bracket where they really need their breast milk.
Yeah, yeah.
So there is no harm in breastfeeding your baby when you're pregnant. I know your mother or your mother-in-law will tell you, no, they might get a wussy, your other child will get what?
What's a wussy?
It's another one of those
myths.
Those things. I took the opportunity to ask my mother-in-law. She told me, when those babies fall sick, usually it's just because the mother is now paying attention to herself and the baby she's carrying. And you know how those babies can be clingy, carry me, whatnot. And the mother is like, go. You know, I am tired, or she wants to lie down and this baby wants to jump on them.
Yeah.
And so sometimes these babies are neglected. Not intentionally, but just because now she has focused on
have that separation.
Else. Yes. So these babies end up getting malnourished or, you know, they are not paying attention to their feeding or just the attention they need. Every baby, if you have a baby who is less than 3 years and you have another baby, that baby is still that child is still a baby. And they could look like they are much older. They are not. They are still little babies. They're toddlers.
Yeah.
And, you know, just getting into school. So tandem feeding comes after that. And there is no worry again to continue breastfeeding your baby. So usually you will be in hospital maybe 2 days.
Yeah.
When you come back, please feel free to continue. Yeah.
What are the risk factors that someone should look out for when they're breastfeeding while pregnant?
Nothing. Nothing.
Is there anything that someone should change in their diet?
Well, take care of your nutrition, because now you're growing two babies. So you're growing this baby who is the one inside. And so the one inside is going to take from you whether you ask for it or not.
Yeah.
So already now you need to take care of that. Then there is all these nutrients which are going into breast milk. So you might need to up your micronutrient intake. So your vitamins, minerals from your greens, vegetables, and fruits, but also your supplements. So you need to talk to your obstetrician to recommend a good supplement for you during pregnancy, so that the nutrients that are available to go into breast milk and then for also growing the other baby are in plenty. Other than that, there is no risk. There's no risk that, you know, nipple stimulation will cause early or an abortion or miscarriage. No. It's not. I haven't found any evidence of that.
Fantastic.
Yes.
Fantastic. The other thing I want you to talk about, why do we lose our hairlines? Why do most moms lose their hairlines? And what can they do to avoid that?
breastfeeding has been wrongfully implicated
Eh?
in loss of hair.
It is not the cause.
It isn't the
Are
cause.
you serious?
Yes.
Okay, what's the cause?
Well, during pregnancy, the hair, you know,
You have
enters
those
a rapid
hormones
growth.
and then
Yeah, all those female hormones are
let me tell
everywhere
you, those
in
hormones
very
are
high
nice.
volumes.
Oh, my name.
They really boost the men.
Yeah.
And so the hair enters into like a rapid growth phase. Faster than its usual. And the hair really grows so fast. Now, once you give birth, we are out of that
hormones
phase.
are out.
Hormones have gone down. The prolactin has gone up. The estrogen has gone down. And now the hair enters into loss and slow growth. So the best thing for you to do, one, is to make sure your nutrition, because your hair is an extension of your, especially protein, yes, what is in the body. So there is already a huge demand for your nutrients, through the breast milk, recovery from pregnancy, recovery from birth. If you had a C-section, even more. Also, mothers don't really take care of themselves very well in the postpartum period because now they're focusing on the baby, plus all their other neurons. Yeah, so they're tired. So extra care for hair. Who has time for hair? When I need a hot meal or I need to bathe quickly before the baby wakes up. So that care, goes out the window. So protective hairstyles, I'm sure you know of that. But also, I learned about applying rosemary oil. It is stimulatory. It really stimulates the scalp, increases blood flow, and helps those follicles, to grow. But also just general good hair routines. So don't pluck,
Don't hold,
and don't put pressure at the front.
Yes.
But also continue with your multivitamins.
Yes,
Or
that's
your,
something that I have
or your
done.
supplements.
I've been swallowing pregnant care since 2018 when I conceived my first child, because I swallow it through breastfeeding. Then I got pregnant after, and I swallow. I've been swallowing it since then.
Critical, because you need to keep supplying and replenishing what you're giving away. Other than these other days where you're just living life by yourself, no one is taking away from you. But now you've created a human being, and then you're nourishing that human being to life. It's definitely going to take away a lot from you than what the non-pregnant female has to give up.
Then now there are some moms who have a baby who somehow, for some reason, I know where it comes from. Like maybe you're in hospital, your child is maybe in the NICU, or some moms have to be away from their babies for some time after giving birth. So the baby gets the bottle and they get used to the nipple of the bottle and they don't want the breast. Is there a way you can get back from that, or now you just reconcile yourself to pumping and giving your baby the bottle? Do you have tips for such moms?
Paste bottle feeding.
Paste,
it's called paste bottle feeding.
What's that?
It's a method we use for feeding breastfed babies to minimize the risk of nipple confusion. What they call nipple confusion, others call it flow preference.
What's nipple confusion?
So it's just this confusion the baby has between, do I like the breast or do I like the bottle? Or that was the breast and this was a bottle.
This bottle
switching
brings
between,
more
and
milk
this
quickly.
bottle brings more milk faster. I don't do any work. I don't have to suck. I don't have to latch properly. And it comes from the same rate because in the breast, the milk comes at different rates. At the beginning, it's slow, then rapid, then slow, then rapid, then slow. And each of those has, different ways it comes. But with the bottle, same rate from the beginning to the end. So baby finally figures out this mommy's breast. It doesn't.
Too much work.
Too much work. Slow flow. Even if it's not slow, even if it's the normal rate,
it is slow. You cannot
it
be
is
like
slow
the
compared to the
bottle.
bottle. You're not the bottle, you're mommy. I prefer the bottle. And so the children, that's how they begin to prefer bottles. So when you're going back to work, please, YouTube, paste bottle feeding.
Paste bottle.
Paste mean the spelling is PACED. There is a way you hold the bottle. And remember how we talked about latching? How you point the nipple towards under the nose? That's the same thing you do with the bottle. So you do that and elicit the same reflex for them to open their mouth. You slide the bottle in as they open their mouth wide. So they are not doing anything different from what they were doing with the breast.
They still have to.
They still have to open their mouth the same way. They still have to latch the same way.
As opposed to
poking in the bottle.
Yeah.
So once they do that, you also need to hold them a bit upright. You don't hold them down.
Because down here, gravity is just pulling.
So you hold them a bit upright. And this starts from newborns, by the way. And then you regulate the flow of the milk. So you never tip the bottle upwards. You always keep it
like
horizontal.
Oh, okay.
Parallel to the floor.
Okay.
So that the baby has to work.
Yeah.
He has to suck. He doesn't just drink. He has to suck. So he will suck. Give him a minute. Remove the bottle from the mouth and leave the nipple at the lower lip. Do the same thing. So up, down, until the bottle runs out.
So they know that it's not
it's not just free flow.
Go.
Yeah. And it actually reduces how much milk they take. So it also works on that overfeeding bit. Because babies who are bottle fed, whether it's breast milk or formula, always overfeed.
Yeah.
Because also the person who is giving them the feed wants them to finish the bottle.
Like, you gum 250 mils. Tomorrow I'm increasing. Yeah.
Yes, and there's also an amount of time the stomach communicates with the brain to tell it that I'm done. Now, if he finishes a huge amount of milk in less than that, the brain has not yet, so he will continue acting hungry. And then you'll be like, he used to take water. No, he wants more. I think he's starving.
Wow.
That's where our troubles come from. This is also a good thing for mothers who are pumping and are away at work, so that they don't feel pressure on them to increase the pumping. Yes, that increase might be artificial because your baby is drinking much more than your pumping.
He's being fed like this.
Yes, gravity is working on him. He's drinking so much more milk than he's used to taking.
Yeah.
That means that now they're going to start asking you for more milk. And yet you're thinking, how can I produce more milk?
I cannot keep up.
Yeah. Let's just bring for milk.
Yeah.
Whereas if you paste the feed, they would check, what they are comfortable taking, and there would be no pressure on you.
Yeah.
So that's important.
That's amazing. The Bible says we perish for lack of knowledge.
Oh, yeah.
We really need have that knowledge. Now, lastly, I want you to share breastfeeding essentials. If I'm pregnant and I plan to breastfeed my child, what are the things that I need to have around me? I've heard of moms go to hospital with a tin of formula. So tell us, what are the essentials?
So for a mother who is intending to breastfeed, which is most mothers, if you're intending to breastfeed, your number one essential is going to be information. Evidence-based information. So information based on research, not the myths we are talking about, not hearsay.
My auntie did this.
Yeah, my auntie.
By science.
Yes. There are things your auntie says, your mother says that are scientific.
They were just passed down. Yeah.
Then there are those which are passed down. But you need to be able to tell that this one is passed down. This one has something
science
to it. Yes. And many mothers, grandmothers, they know some things which they didn't have a scientific fact to relate it with.
Yeah.
So you need evidence-based information. That's one. Two, your support network. Critical. Your support network should be people with positive birth experiences, positive breastfeeding experiences.
Yeah.
But also people, even if they had negative experiences,
they are not passing them.
They're not passing them on to you. But also they have found, like how I had negative experiences.
And you found a solution.
And I found a solution to them and a positive angle to it.
Yeah.
Because this is called self-efficacy. Your own confidence in your ability to do what you've decided to do.
Yes.
So there's breastfeeding self-efficacy.
Yes, because breastfeeding is a lot with
it has a lot to do with your mind, how you think about it, what you perceive about it, what fears do you have about it, what concerns do you have about, what goals do you have. So your support network, expand it. Mother support groups are critical. They are good because you see other people going through what you're about to go through and how they are handling it.
Yeah.
Other than responding to it in fear, respond to it by finding the right information
And the right support.
But also the right expertise. So there are those of us who have put in so many years from personal experience, but also from seeing so many other mothers. So other mothers, our own experiences, other mothers,
experience.
but then also education. We invest a lot in our education. If you were making samosas, your supplies would be wheat flour, maybe beef, the filling. That would be your supply. For us, our supply is information and education. So we are constantly educating ourselves to learn how to support mothers best in the most compassionate way.
Yes.
Because mothers really, really need someone who is compassionate, not judgmental.
You're not going to come and say, you're just lazy.
No. Yeah. You don't know what that mother has been through to even come to you. Or to even post in the group. You can't call her lazy. She loves her child. She's not going to harm the child, but she's going to act based on the information she has. That is why we really strive so much to give, deliver information. So now that we've dealt with the important things, let's deal with these things that people like, product. So just a minute. So your expert would be a lactation specialist like myself, a well-educated midwife who knows what she's doing. You would see that based on how she's supporting you, but also from reviews. So we invite you to come and check out our reviews.
I'm going to share Dr. Doreen's contacts in the description.
Yes. So then you need to choose your hospital. So where are you going to give birth from? What is their level of breastfeeding support? So do they have someone on the team who comes to look at the two of you, like we talked about that. So they are paying attention specifically to the breastfeeding. Yes. And they are going to be able to have that time to sit, because that's their work. Their work is not that they are, doing other things and then they try to do some breast. No, their work is that they are looking at you specifically, and they have the expertise. They know how to support you in a skillful way. They've seen many mothers like you, and they've also seen the rare ones. So you need that person. Look at that hospital. Does it have those services? If they have those services, maybe have a session with that person before you give birth. You want to know the important things in your birth plan, like Daisy talked about. Where are you on skin to skin? Like, what's your policy on skin to skin? Early initiation of breastfeeding. How soon do you dress babies? How soon do you bathe babies? Do you recommend formula? You can just look at that by looking at the requirements. If there is formula on that list,
you just know.
Suspects, they are not going to support you.
Your breastfeeding journey.
Very well. They are going to easily resort to formula. And they have so many excuses. The baby's blood glucose will drop before they even check it. So you want to make sure that your team has that person, has that support for breastfeeding. Someone who's not so, like how you don't want people to be so quick to suggest C-sections. Let's normalize not being so quick to suggest formula. When the person says formula, ask them, what else can I do to help me get the milk, increase my supply, before you suggest formula. Let formula be there, with a good reason. Now, have your breasts checked. I'm sorry, these essentials are not good. But have your breasts checked. Because that's in the antenatal period. That's when we'll be able to tell that your nipples are flat, inverted. You have accessory breast tissue under your arm, which can get you. So the breast tissue stretches up to the armpit. So sometimes when you get engorged here, you get engorgement in the armpits.
I actually had an engorged boob this last time, and I was reading up on those massages, and they tell you to massage from up here, about to drain the lymphatic. Well, what?
This way, actually.
Like this, right?
Yes. So there is accessory breast tissue in the arm. It's called I forgot the name. Tail of Spence. So you'll see a mother who has a swelling in the arm. It's not a lymph node or cancer or something. It's breast milk. Wow. So the same thing you do to relieve the engorgement. Yes, the same thing you do.
You massage. Wow.
So you have your breasts checked. Is it the size? Do you have a scar? If you've ever had a scar from surgery, they removed a lump or something, it could have destroyed nerves, blood vessels, ducts, which will mean a different story when your milk starts coming in. Have the nipples checked. Are they flat, inverted, small, big, long, double, accessories?
Yeah, all that is information.
All that is
that will
information you
empower
get
you.
from
Yeah.
in the antenatal period. Let it not be the first time for someone to see something different when you've given birth, because now at that time we are panicking
The baby needs you.
and the baby needs you. Yeah. So if it was flat nipples and we found out that those nipples will never erect, then maybe we can suggest, we give you skills. We use tools. Maybe we'll ask for a nipple shield. Maybe we'll tell you to try and pump out the nipple. That's if it can come out. Some don't. But we can't. Trying to fix that in that moment is too much for you.
Yeah.
You'll just feel overwhelmed.
Yeah.
Hand expression skills. Very critical.
How do you hand express?
So you use these two fingers and you find the edge of the areola, which is the black part.
The areola is the black part of the
just
hole.
Surrounding the nipple. So the easiest place to go to is the edge, and you comfortably place your fingers, these two fingers there. Then you press back into the breast, and then you press your fingers together. Don't press the nipple. Press your fingers together. I usually see this when I tell moms, do you have milk? They're like, no, there's no milk. Like, how did you know?
They were pressing the nipple.
I pressed. Then when they press the nipple, nothing comes out. Then when they press the areola, milk squirts out.
Wow. Imagine all these years I've been hand expressing the wrong way. Yeah.
On your third baby.
On my third baby. I would start from the edge of the areola, but then I would pull out. Yeah.
You just compress the areola like this as you push backwards. And by the way, you don't move your fingers. You keep them in the same place.
And just push.
Push backwards.
Okay.
It's just
thank you so much. You're doing the Lord's work. Another one.
So that is so you learn hand expression. Yeah. Hand expression is easier for colostrum. Whereas for pumping, you can find that you pump your colostrum and it just gets lost in the pump parts because it's in small volumes. Some people have much more colostrum than others. So it's easier to just collect the colostrum by hand expression on both boobs.
Yeah.
And then you can, learning that skill should be part of what they do in the hospital when you're in the hospital. Now, please put all those things in your birth plan and communicate them to your doctor. Now, you might or might not need a pump, depending on whether, let a lactation specialist advise you, because that will depend on your nipples and all that. If you're planning to go back to work within about 3 months or whatever time, and you feel like hand expression won't work for you, although you can't tell that until you try it, because some moms just throw away the pumps and use their hands.
One of my friends says hand expression works best for her.
Yeah,
she does.
And I like hand expression. Permit me to say, you have hand. Everyone has hands, okay, except I'm there enough hands. Everyone has hands and probably all their fingers. You walk around with your hands. You know, you can forget a pump part at home. Or a pump part can get spoiled. Or your pump is not sterilized. Or your pump is not working well for you. But you have your hands, two of them at that. You go everywhere with your hands. You don't need to boil these hands, sterilize them like expensive electric equipment. You just wash your hands. You don't need electricity for hand expression. So whether there is umeme or not, you can hand express. You don't need, sophisticated equipment. Your hands are there for you. So for me, hands
is your go-to.
Is my go-to. I make sure every mother who I see learns hand expression, whether she uses it or not, because it's also important when you're doing things with engagement and whatnot. Now, the other essential is you might or might not need a nipple cream. My best nipple cream is breast milk. I just apply breast milk, and that's it. I don't need a nipple cream. But some moms feel they need nipple cream. Please get one if you
For
think
me,
you
it
need
helped
one.
me a lot. And the one I used, because I needed it with my first baby, I used the Lancino one.
So there are different brands. If you went to a pharmacy or a baby shop, you will find different brands. Choose the one you want. So a nipple cream. pump, nipple cream. Now, when you're choosing pumps, won't this be another show?
No. When you're
When you're
choosing.
choosing pumps, someone needs to measure the size of your nipple. Most pumps come when they are fixed. So it's one continuous piece of plastic. But if you look at types like Medela, sometimes Tommy TP, the electric one, they have a detachable flange, the part that sits on your breast.
Yes.
If you could buy a type that has a detachable flange, that means you could get another
Can
size.
get another flange.
Yeah, which would work with your nipple size. So if your nipples, recently I saw a mother who had a 24mm Medela pump. Medela is a good pump, but her nipples were too big for 24mm.
So
she
it would
needed 27,
hurt.
so she would feel pain. Oh, and the milk wasn't coming. So you could say pumps don't work at all because the milk is not coming because
you failed on that.
of the sizing.
Yeah.
So she had a 27mm one and she was comfortable. She had pain with the 27mm one because she would go straight to level 5. When she would start pumping, she would
pump
go
very fast.
straight away. Yeah.
Yeah.
Whereas, you need to start
Gradually,
slow.
like a baby.
Yeah, like a baby.
Yeah.
And you increase. And she was comfortable with 5, but because she went gradually this time. So please try to buy a pump which has a detachable flange. And probably one which has like a silicone
flange.
yes, a silicone part to add to it because it increases comfort. So pumps, people buy pumps based on cost. But in terms of functionality, they lose out on that. Unfortunately, we can't do anything about because market things dictate.
Yeah.
The other thing, you need a good bras, support bras. Preferably buy those bras after you've started breastfeeding because your boob size will increase, especially in the first week. Definitely breast pads to catch any leakage.
Yeah.
Breast shells. There are breast shells which you can wear inside so that if there's any leakage, you can catch that milk and not lose it in the bra or the breast pad. There are also, what do they call them? Breast milk collectors. They are not absolutely necessary, but it's in the way you apply them. They help in collecting
the
letdown.
Yeah.
So that you don't lose it.
Yeah.
But do not try to induce a letdown with a breast milk collector because it removes all that motivation for the baby to suck. Because the baby starts sucking so that the milk can let down. So if you induce a letdown by the way you apply that breast milk collector, your baby will come this side and there's nothing for them to look forward to. And they've also been implicated in causing oversupply. Oversupply is a problem. People are like, that's a good problem.
I feel like
I would like to
oversupply
have.
is a good problem.
No. I've treated people who have oversupply and have recurrent mastitis, plugged ducts.
I got a plugged duct and this time, and what helped me was that silicone hacker. It helped to pull, but
pull
still
it out, but it was painful.
It was painful.
Yeah, and it could have been your plugged duct might have been induced by oversupply from
because I was breastfeeding
from pulling. So those are some of the things that mothers like to use. There is some nipple shields, preferably prescribed, because nipple shields reduce the flow of milk, which eventually now will have an effect on the supply and order. But sometimes it's necessary, which might be the only thing that gives this mother and baby a breastfeeding relationship. So sometimes you really need to use, but again, you need to size your nipple, because not all nipple shields will work for you. Someone told me one of these popular baby stores was rebuking her and telling her, no, you don't know how to use it and whatnot. But this was again a 24mm nipple shield, and her nipples were beyond 20, they were 27. But they didn't give her that advisory. Yes. So she was blaming herself for not knowing how to use the nipple shield. But I've also seen nipple shields that just slide off. You don't know how those ones work. If you could get a nipple shield that has very little silicone on the upper side, so that your baby's nose can touch the breast and smell the milk and stimulate the flow. That would be good.
Okay. And then do you recommend that we get these pillows?
Pillows. I have a bittersweet relationship with the pillows. Sometimes,
I feel like they help.
sometimes they help, sometimes they don't. I think it's in the use of the pillows. Some people assume that the baby should be on the breastfeeding pillow.
That's how I was with my first baby. I would put my
first
pillow, then put the baby like this.
and then go at it.
That's how I was. I would even cross my leg. Yeah.
Oh, that is where breastfeeding pillows, might not be of help to certain mothers. For example, if your breasts are high and they're not pendulous, like they're not falling downwards, then you have to hold the baby. So you tell me how far you're going to raise this pillow.
Or how big the pillow
the pillow has to be.
Yeah.
There's a pillow called My Breast Friend. Now that's a good pillow. It has.
Is it here in Uganda? It's not here. Okay.
It has more. It's more of foam and shaped. It's not like the boppy pillows. Those are like a donut. They I think it's more firm, but it's also adjustable, and it has a strap where you can raise it a bit and then strap it so that it's in place and it can support you at whatever level.
Yeah.
The common ones I see around, you might have to raise your legs or cross leg like you did, or have an additional pillow. That way it would help. But breastfeeding is not a punishment. If you feel your arms need support, please get a pillow quickly and support either your elbows when you're doing underarms, support them over here. Support. Remember, I talked about comfort and not having pain when you're breastfeeding.
Yeah.
That's key.
Yeah.
If the mother is struggling to keep the baby in place, she's not going to like this thing.
Enjoy it.
Yeah, and it's enjoyable.
And you get tired. I love breastfeeding. It's honestly very
I do too.
Yeah.
I do too.
Do you have anything else?
Yes, about this information thing. Well, as you may know, there are not more than one lactation doctor in Uganda. We have 2 other breastfeeding specialists, and that is like 3 professionals plus plus some nutritionists and some midwives and whatnot. But like I told you, our highest the thing we consume the most is information and education. So those who have had expert training are very few. So we figured that, every Ugandan really needs this service, but we are not going to reach everybody, as 3 or a handful of us. So as Naturally Nourish, the company I work for, we came up with a contact center. So a contact center is like a call center, but it uses so many other platforms, WhatsApp, videos, to deliver the services. So mothers can now call us on a toll-free number and get all that information I've been telling you about in a consultation, in a virtual consultation. You don't have to move from where you are. As long as we deem that the best solution for you is virtual and not necessarily physical, then we have a virtual consultation.
This virtual also has a video.
Yes, it also has a video component. But sometimes you need a physical consult. So if that is necessary, then we refer you to one of the sites where you can find us. But our contact center is open and running. I'm sure Daisy will share the information
in the description.
Yes. Yeah. Otherwise, every woman can breastfeed with the right support and can achieve her goals, depending on, wherever level she's at.
I have just one last question. Are there women that just will not have supply for their baby?
Yes.
And what's that percentage?
I think in the general population, this is not even in Uganda, because that kind of study has not been done in Uganda. I hope to actually do it one day. But the percentage is so small. Of all the mothers I've seen, I think I've not met more than, let's say, 20. Now, what happens with them is that during puberty, their breasts did not grow. Did not get that gland, those glands that are supposed to increase during pregnancy and produce milk. But also mothers who have conditions like polycystic ovarian syndrome, PCOS or PCOS. diabetic mothers,
People who have had cancer, breast
people who
cancer.
have had breast cancer and the breasts were cut off, of course, they will
Yeah.
not breastfeed.
Yeah.
Those who have abnormal glucose levels, the diabetics and other conditions associated with that. But mainly the group of mothers I'm talking about is the ones whose breasts are structurally not
able
to produce milk. I have seen them. I didn't hear about them on the internet, but I've seen them and supported them. We even have a group for them. And they will tell you that no matter what I do, no
It's not
milk is
coming.
coming. But typically they'll tell you their breasts didn't change during pregnancy at all. But you'll also see their breasts and their breasts look a certain way. You'll just see the breasts are fast-paced. They don't have that roundness of a mother who's breastfeeding. But again, these are things that the other eye, the eye that has never seen them will not see them. They'll see them and they will not even make head or tail of them. But we are able to put that information together. Unfortunately, most of these mothers are seen like on their second or third baby when the situation has repeated itself because it's the same cause. But I was glad to find one recently who just had her first baby.
So you were able to help her in time.
Yeah, in time. So that she was already supplementing, but she just wanted to know what is happening. Why am I not able to produce all the milk that
my baby
needs? And that was the issue. So this business of all women can breastfeed, and rather all women can, I think all women can breastfeed, but all women can produce all the milk their child is false. There are those who just have
naturally
who can't.
And
there are ways we support them. Some of them go on to have a full supply, some don't. But again, now we have to redefine what success is for those mothers, or they have to redefine what success is for them.
Okay. Yes. Thank you so much, Dr. Doreen.
Welcome,
I believe this has been very insightful for you guys, for everyone, even for me. Like, I didn't know how to hand express. So may this video be your go-to for anything you need to know breastfeeding. Feel free to share it with a new mom, with a pregnant mom, even a third-time mom. Come on, I was here learning things. So share this video far and wide, and let's help every mom around the world. See you in the next one. Bye.